This meeting is now being recorded.
Greetings. This presentation is on Dr. Leininger's Transcultural Theory of Nursing. My name is Sarah Moore, and I had a few co-authors, Peggy Katzman, Paul Edsman, Jewel Amantia, and Rosanna Guerrero. Madeleine Leininger was born on a farm in Nebraska. It's a very humble beginning to such an amazing theorist. This humble beginning impacted the world of transcultural nursing. Upon completing a doctorate's degree in anthropology, she proceeded to develop new nursing theories, incorporating the components of her nursing background and her doctoral education. Dr. Leininger began an entirely new field of nursing, providing cross-cultural or transcultural care as we know it. Her work in transcultural nursing theory remains a sole theory focused on transcultural care. Who is Madeleine Leininger? She was a nurse who believed in studying the science of people and analyzed what they needed to become healthy and whole. Her interests were in nursing, and she knew that nursing could do more to promote the well-being of people who were being cared for. On a trip to New Guinea back in 1960, her experience opened her eyes to the need for nurses to understand their patient's cultural background in order to provide care. As a result of her travels and other nursing experiences, the transcultural nursing theory was developed. What is transcultural nursing theory? The definition of transcultural nursing theory is a humanistic and scientific area of formal study and practice in nursing, which the focus upon difference and similarities among cultures with respect to human care, health, and illness based on people's cultural values, beliefs, and practices, and to use this knowledge to provide cultural specific or culturally congruent nursing care for people. Emphasis of the transcultural nursing theory. She has always been believed to take care of the human being as an individual is the vital part of nursing. In order for nurses to care for a human being as an individual and give them the highest quality of care, understanding these individuals and what is important to them and their belief systems is essential. Human beings in need of nursing care come from all over the world with all different types of needs and all cultural views. Without understanding these views, providing patients with quality care that they deserve is very difficult. Dr. Leininger believes nurses need to assess patients, discover their specific values or belief systems, and implement these practices into the nursing care. She feels that these specific cultural assessments are important in maintaining high standards of patient care. Goals of transcultural nursing theory. The emphasis of transcultural nursing theory is to recognize various cultures that people are a part of and understand how their belief systems may affect how nursing care is approached, planned, and carried out. Before being able to truly understand what Dr. Leininger was referring to in her theory, some basic concepts need to be understood. The most important is the term culture. According to Leininger, culture refers to norms and practices of a particular group that are learned and shared and guide thinking, decisions, and actions. According to Dr. Leininger, cultural values are the individual desirables or preferred ways of acting or knowing something that is sustained over a period of time, which governs actions or decisions. Nurses need to recognize the importance of understanding their own belief systems and be open-minded to others. Nurses need to avoid stereotyping and learn to be flexible and respect other points of view to promote quality nursing care. Culture and cultural values may strongly determine how a patient perceives their illness and well-being, their responses to treatment of care. Understanding the cultural structures of human beings so nurses can clarify, understand, and predict the broad scope of patients' behaviors will help promote quality care for patients. The goal of the transcultural nursing theory is to give patients culturally diverse nursing care by providing comfortable atmosphere which promotes healing and well-being for the patients. Before completely understanding the goal of transcultural nursing theory, recognize how Dr. Leininger defined cultural diversity nursing care is important. Cultural diversity nursing care is an optimal model of healthcare delivery. Refers to the variability of nursing approaches need to provide cultural and appropriate care that incorporates an individual's cultural values, beliefs, practices, including sensitivity to their environment from which the individuals come from and to which individuals may ultimately return. Being open and honest about care for patients of other cultures while maintaining safety and professionalism is very important. For nurses to admit to patients that they are not familiar with the culture but are willing to learn and help in any way possible while continuing to follow policies and procedures of the hospital or organization is completely acceptable. Nurses need to continue to search for ways to provide quality care by incorporating patients' cultural beliefs into their care. Being creative and putting forth effort to accommodate various cultural differences will in most cases be appreciated and valued by patients. Leininger's theory addresses clients as humans who are cultural beings who have survived through times and places because of their ability to care for infants, young and older adults, in a variety of environments and ways. Simply stated, this means that they cannot be separated from their culture. According to Fitzpatrick, Dr. Leininger believes that the person is difficult to define and that it should be conceptualized, defined, studied from cultural perspectives. Leininger's perspective is that human beings include individuals, families, groups, communities, and total cultures and institutions. Environment is vital to her theory because it influences health and care patterns of individuals, families, and cultural groups. Environment is defined as the total of an event, situation, or particular experience that gives meaning to human expression, interpretation, and social interactions, in particular physical, ecological, and socio-political and or cultural settings. For Leininger, human behavior was influenced greatly by environments and very greatly depending on particular environments was in it. Health is defined as a state of well-being that is culturally defined, valued, practiced, and which reflects the ability of an individual or groups to perform their daily role activities and cultural expressions and patterns in their life ways. Dr. Leininger believed that in order for nurses to determine a patient's state of health, they would need to understand it from a patient's view and what health according to that individual cultural beliefs is. Leininger found the transcultural nursing theory to be really challenging for her to promote in the 1950s and 1970s. Here in the United States, there wasn't any real research-based transcultural knowledge, and some of her theories were discredited. Many laughed at her theories, and they thought it was unnecessary and inappropriate, and that she was wasting her time. So she ended up moving over to Australia, where her theories were adopted. By 1997, research and other nursing scholars were starting to see the transcultural nursing theory as a reality and as an important tool in nursing care. In 1997, the transcultural nursing findings were gradually starting to change the way nurses view various cultures and beliefs. Dr. Leininger predicted by the 21st century that transcultural nursing theory would be essential for nursing practice, and she was correct. In the past 3 decades, with immigration and the travel opportunities available, people from different cultures are using the United States healthcare system more often than they ever have. With the movement of technology, nurses can only expect that exposure to cultural diversity will continue to grow. Continued awareness of other cultural values and belief systems is essential for nursing. A willingness to learn about cultural differences and the use of transcultural nursing theory in practice is vital for nurses and patients in the healthcare setting. Teaching Dr. Leininger's basic concepts of cultural care in hospital settings requires a commitment from administration staff, physicians, nursing staff, direct care, any other staff that's involved in the patient's care. Strong leadership is essential to ensure that staff becomes engaged with the transcultural theory, adopting the quality and the frequency of training, and any emphasis on teaching for transcultural nursing. Leininger had denied any specific influence with her theory of cultural care. However, she acknowledged the importance of selective personal and professional ideas in guiding her thinking. Humanistic, ethical, and moral care values learned in childhood and in her basic nursing program were carried into her early work as a private duty nurse. She explains that there were always normative cultural expectations to be humanistic, compassionate, and ethical in doing what is best for the patient, and to be morally committed to help the patient and his or her family. This theory needs to be practiced and taught across the board. Why cultural training? Cultural blindness occurs whenever staff believes that they do not need cultural training because they treat everyone the same. By doing that, they assume that everyone is comfortable with the same treatment. When staff understands their own bias, then they will react differently. In some cultures, women may not make eye contact, or men may need to pray at certain times of the day. All these things need to be considered in the relationship to their care. It is our job as nurses to be more knowledgeable in different cultures. And as nurses, we need to ask the right questions that may impact patients of their healthcare needs. Dr. Leininger's transcultural nursing theory should be applied to the classroom too. It is understood that Dr. Leininger's theory was meant for patient care, but it can be applied to nursing leadership as well. Nurses can become sensitive to beliefs that is unknown, to be willing to educate themselves, and to have a learning desire. Dr. Leininger also warns nurses that it is dangerous to assume that people from certain cultures are all the same. This theory can be useful in the classroom. How to apply Dr. Leininger's theory to an online classroom. Some examples can be to educate yourself, be aware of your own cultural biases. Educators should wear non-offensive clothing and modest makeup during voice threads and other presentations that are given to students to avoid insulting transcultural groups of students. Educators need to make sure that their material that is used in the classroom strictly applies to the course content. When discussing ethics, students' needs need to be considered. Making sure that content does not make other cultural groups appear to be negative. And teaching these principles to future nursing students as well. These are my references. Thank you for taking your time to view my presentation.